Good afternoon, class. Today, we will be learning about examination of skeletal remains. A forensic medicine expert may receive a sealed evidence bag which allegedly contains a bone or multiple bones. These bones could have been recovered from open areas like fields, from forests, construction sites, mass graves, etc. As experts, we have to determine whether the evidence contains bones or not, and if they are bones, whether they are human or animal in origin, and if they are human, whether they belong to one or more individuals. We would also have to determine the race, sex, age, and stature of the individual or individuals. Finally, we also need to determine probable cause of death and time since death whenever possible. Here, the concerned investigating officer has handed over a sealed evidence bag with a requisition letter to examine the alleged bones. There are red colored wax seals along the stitched seams of the evidence bag. After noting down these details, we can now proceed with the examination. The initial part of the examination of given set of items are as follows. Firstly, we need to determine whether the alleged items are in fact bones or not. In order to determine this, we can study the morphology and histology of the given items. Thereafter, if the given items are bones, we need to determine if those bones are human in origin or belong to an animal. This can be determined by studying the morphology and, if needed, confirmed by doing a species-specific test like precipitin test. If the given bones are human in origin, we need to determine if they belong to a single individual or multiple individuals. For example, here we have a set of bones. As you can see, there is one skull, two mandibles, two hip bones, and three femurs. Since there are three femurs, it is very evident that they belong to more than one individual. Now, if you look at the hip bones, both are left-sided hip bones, and since the greater sciatic notch on this hip bone is wide and shallow, while on this hip bone it is narrow and deep, we can say that these hip bones belong to individuals of different sexes. As you can see, this mandible is edentulous, implying that it belongs to an elderly individual, while this mandible belongs to an adult. Thus, by looking at various features of the bones, it is very evident that these bones belong to more than one individual. For examination of any skeletal remains, we should follow a similar procedure in order to determine whether the bones belong to a single individual or multiple individuals. In today's class, we will be learning how to determine the sex of an individual using skeletal remains. Firstly, let's look at the features of the skull. In front of us, we have two skulls. In this skull, the frontonasal angle is less distinct, while in this skull, it is distinctly angulated. In this skull, the glabella is less prominent, while in this skull, it is more prominent. In this skull, the supraorbital ridge is less prominent, while in this skull, it is more prominent. In this skull, the mastoid process is smooth and pointed, while in this skull, it is rough and blunt. In this skull, the zygomatic arch is less prominent, while in this skull it is more prominent. In this skull, the occipital protuberance is less marked, while in this skull it is more marked. In this skull, the digastric groove is shallow. While in this skull it is deep. By looking at all these features, we can say that this skull belongs to a female individual and this skull belongs to a male individual. The other features which can be used to differentiate between a male and female skull are orbital margin, shape of orbit, slope of the forehead, frontal eminence, parietal eminence, foramen magnum, occipital condyles. Now, let's take a look at the pelvis. In front of us, we have two pelvises. In this pelvis, the subpubic angle is wide, while in this pelvis, the subpubic angle is narrow. In this pelvis, the ischiopubic ramus is more everted, while in this pelvis, it is comparatively less everted. In this pelvis, the acetabulum is directed anterolaterally, while in this pelvis, it is directed laterally. In this pelvis, the pubic bone appears to be quadrangular in shape, while in this pelvis, the pubic bone appears triangular in shape. In this pelvis, the obturator foramen appears triangular in shape, while in this pelvis, it appears oval in shape. Ischiopubic index or Washburn index is calculated by the ratio of length of the pubis by length of the ischium. Length of the pubis is measured in a straight line from the center of the acetabulum to the medial end of the pubis. Length of the ischium is measured in a straight line from the center of the acetabulum to the lowermost point on the inferior border of the ischial tuberosity. In this pelvis, the greater sciatic notch is wide and shallow, while in this pelvis, it is narrow and deep. The sciatic notch index is calculated by the ratio of width of the greater sciatic notch by depth of the greater sciatic notch. The width of the greater sciatic notch can be determined by measuring an imaginary line drawn between the ischial spine and the piriformis tubercle. Now, depth of the greater sciatic notch can be calculated by measuring from the midpoint of this imaginary line to the lowermost point of the greater sciatic notch. In this pelvis, the pelvic brim is circular in shape, while in this pelvis, it is heart-shaped. In this pelvis, the pelvic cavity is broad and round, while in this pelvis, it is funnel-shaped. The preauricular sulcus, which serves as an attachment of the anterior sacro-iliac ligament, is seen on the iliac bone, adjacent and parallel to the inferior surface of sacro-iliac joint. It has been described to be more prominent in the female pelvis, especially in women who have given birth. In this pelvis, The preauricular sulcus is very prominent. While in this pelvis, it is barely seen. By looking at all these features, we can say that this pelvis belongs to a female individual and this pelvis belongs to a male individual. Now, let's take a look at the features of the sacrum. In this sacrum, the sacral promontory is less prominent, while in this sacrum, it is more prominent. In this sacrum, the sacroiliac articular surface extends up to 2 to 2.5 segments, while in this sacrum, it extends up to 2.5 to 3 segments. This sacrum is abruptly curved, while this sacrum is comparatively uniformly curved. In this sacrum, the body of the first sacral vertebra is less than the breadth of either side of ala, while in this sacrum, it is more than the breadth of either side of ala. The corporobasal index is calculated by the ratio of breadth of body of first sacral vertebra by the transverse diameter of base of sacrum. In this sacrum, maximum breadth of body of first sacral vertebra is measured. Then the maximum transverse diameter of base of sacrum is measured. The sacral index is calculated by the ratio of transverse diameter of base of sacrum by anterior length of sacrum. In this sacrum, the maximum transverse diameter of the base of sacrum is measured. Then the maximum anterior length of the sacrum is measured. By looking at these features, we can say that this sacrum belonged to a female individual and this sacrum belonged to a male individual. Now, let's take a look at the features of the mandible. In front of us, we have two mandibles. In this mandible, the angle of the mandible is more obtuse, while in this mandible, it is comparatively less obtuse. In this mandible, the ascending ramus is not so broad, while in this mandible, it is comparatively broader. In this mandible, the condyles are small, while in this mandible, the condyles are comparatively larger. By looking at all these features, we can say that this mandible belongs to a female individual and this mandible belongs to a male individual. The other features which can be used to differentiate between a male and female mandible are the height of the chin at the symphysis mentae and the outline of the chin. Now, let's take a look at the features of the femur. In front of us, we have two right-sided femurs. The features used to differentiate between a male and female femur are head, vertical diameter of head, neck shaft angle, bicondylar width, outer condylar angle. The accuracy of sex determination from any given bone or a set of bones was derived by Krogman. According to Krogman's index, the accuracy of sex determination from the skull alone is 92%. From the pelvis alone, it is 95%. From a long bone, it is 80%. From the skull and pelvis together, it is 98%. From a long bone and pelvis together, it is 98%. And the entire skeleton is 100%. Now, let's look at how we can estimate age of an individual based on closure of skull sutures. The fusion of skull sutures follows a predictable pattern. The endocranial aspect of a suture closes 5 to 10 years earlier than the ectocranial aspect. Sometimes the ectocranial aspect remains unfused. This is called lapsed union. This is the midtopic suture. It fuses by 2 to 8 years. Since this is an adult skull, this is an example of lapsed union of skull suture. This is the sagittal suture. The fusion of the sagittal suture occurs in 3 segments. The posterior 1/3 fuses by 30 to 40 years. The anterior 1/3 fuses by 40 to 50 years. And the middle 1/3 fuses by 50 to 60 years. This is the coronal suture. The fusion of the coronal suture occurs in 2 segments. The lower half fuses at 40 to 50 years, and the upper half fuses at 50 to 60 years. This is the lambdoid suture. The lambdoid suture fuses above 50 years of age. This is the basi-occiput, and this is the basi-sphenoid. The basi-occiput and basi-sphenoid fuse by 20 to 22 years in males and 18 to 20 years in females. The endocranial aspect of a suture is best studied by removal of the skull vault and direct observation. Now, we shall see the difference in the iliac crest where the ossification center has not appeared, where the ossification center has appeared but has not fused, and where the ossification center has appeared and fused. Here, in this iliac crest, we can see that the surface is rough with ragged margins. This implies that the ossification center of the iliac crest has not appeared. Here, in this iliac crest, you can see that there is a groove. This implies that the ossification center of the iliac crest has appeared but has not fused. In this iliac crest, we can see that the surface is smooth. This implies that the ossification center of the iliac crest has appeared and has fused. Now, let's look at how we can estimate the age of an individual based on ossification centers in the sacrum. The 5 sacral vertebrae remain separated by cartilage until puberty. With the onset of puberty, ossification of intervertebral disc start from below upwards, and the fusion of the sacral segment become complete by 20 to 25 years. Now, let's take a look at the changes seen in the mandible as a person grows older. In a young child, the ramus is narrow, and as the person grows older, the ramus becomes wider. In a young child, the mental foramen would be closer to the lower border of the mandible. In an adult, it is located more in the middle. and by old age it is located closer to the alveolar margin. Age from mandible can also be estimated by observing the eruption of teeth. An orthopantomogram will provide more details about eruption of the teeth. After examination, all the bones are placed together in a box, which is then packed and stitched with white cloth. The stitched seams are sealed with red colored wax seals. The sealed evidence bag will then be handed over to the investigating officer. This concludes examination of skeletal remains. Thank you.